Hi, Sally Walker here, your hormone and slow age expert. So let's talk prostate cancer because it is one of the most prevalent cancers in men. And UK statistics tell us that prostate cancer accounted for 13% of all cancer deaths in 2018, which was 11,900 deaths, making prostate cancer the second most common cause of cancer death for males in the UK. So it is something that we need to be aware of. So 1 in 4 men that are Afro-Caribbean, Afro-American have a risk for prostate cancer, where Caucasian males it's 1 in 8. So if you are Afro-American or African, then your risk for prostate cancer can be double as high as white Caucasian men. So you need to be more virulent with keeping an eye on your prostate and having the PSA checked initially. Okay, so what do we know about the cause? That's a really good question, Sally. We know very little about the cause. The cause is absolutely unknown. In a way, I think it's the same as breast cancer. The cause really is not known. We know that estrogen feeds it, and in the prostate here, we know that the testosterone and the DHT will feed it, but we don't really know why it's caused. There will be obviously some genetics involved, and definitely age plays a role. So it always makes me think about the liver when we talk about age. But anyway, age, genetics, family history, well, that's genetic, isn't it, really? As I said, race, so Afro-Americans are going to have a 75% increased risk, so yes. So then there are dietary habits here. So I would say be very careful of the omega-6 fatty acids and be very careful of all the sugars. And then the alcohol, and then the smoking, all of these things that we know are going to increase oxidative stress. So we know oxidative stress is what creates the DNA damage, which can trigger the cancer genes. So be very careful of those. And that's for any cancer. It is nothing particular for prostate cancer. So very, very important. But as I said, the real cause is absolutely unknown. The challenge with prostate cancer is that for many, many, many years, there are no symptoms, because until the tumour is big enough, it doesn't press on anything, there's no pain, it doesn't press on the urethra, so there's no peeing problems as there are with the enlarged prostate. So it's not until it is quite late in its stage that they become symptoms, which could be pains in the groin area, pains in bones around that area, so hip and pelvis and lower back and things like this. Could be indicators of prostate cancer, but then the stage is way on its way into stage 3, stage 4. I'm not quite sure how they stage these prostate cancers, but yeah. So initially, and this is what we often hear, that men eventually get off to the doctor and get themselves checked, and they've got a very, 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 very high PSA, and they do some MRI scans, for example, which is the favourite choice now for diagnosing, and discover that they have a very big cancer in their prostate. But they say, but I didn't have any symptoms. No. So this is why testing is very important. And as I said, at the moment, the only test we have really to give an indication is PSA. And you want to get it tested as soon as possible, 45 to 50 years of age for the first time. And possibly having it done every second year until you're 60, and then possibly from then on having it done every year would be a good thing to do. Okay, anyway, lots more information about prostate cancer, lots more information about the benign prostate hyperplasia, lots of articles, other videos. Enjoy. Happy hormones, happy life.